COVID-19 is primarily known as a respiratory illness, with continuous cough and high temperature being the most common symptoms. However, research has shown ocular symptoms may be present in some patients. In a study published by BMOJ Open Ophthalmology, researchers sought to find out whether the symptoms were different with chronic anterior eye disease when they experienced the symptoms and how long they last compared to other COVID-19 patients. The results found the most reported symptoms to be dry eye, fever, tiredness, and loss of smell and taste. Meanwhile, the three most common eye symptoms, including photophobia or light sensitivity, sore eyes, and itchiness. The presence of sore eyes is more significant in patients during COVID-19 compared to before they contracted the disease. COVID-19 spreads through droplets emitted when a person coughs or sneezes. These particles usually enter through the nose or mouth and sometimes from the eyes. Transmission is also possible when a person touches any surface that has come into contact with the virus, such as door handles, dining tables, and others. However, this is not the primary method of transmission. A person with eye conditions such as conjunctivitis that occurred as a result of coronavirus infection can also spread it to others when they touch their eyes and made contact without hand washing.
Okay, now I'm getting scared. I'm getting scared.
Is that why you have that?
I got my
Eye drop.
eye drop. I'm gonna drop it just a little bit. There you go. There you go.
You actually think that the eye drop will actually help clear out the virus?
I'm just hoping it's just gonna give some clarity from the virus.
Well, this is why we're trying to clarify some information, right? It's like whether that eye drop will be able to clear out any potential virus, that has been exposed into our eyes. But that's true, and that study has also been underlined by Nature Communications, that COVID-19 virus can actually be contracted through the eyes. So what is exactly the process, and how do we best protect our eyes in the pandemic? And that's why we have an ophthalmologist today, right?
Exactly. We're now connected with an ophthalmologist, Dr. Kianti. Good morning, Dr. Kianti.
Morning, doctor.
Good morning, Doc. So, this is something that I heard about this, but I thought, COVID-19 is a respiratory virus, a disease, right?
Yes.
So how could it affect our eyes and then COVID-19? What's the correlation between our eyes and COVID-19, Doc?
Yes, well, like many infections caused by a virus, even influenza, coronavirus too can infect and replicate in our eyes through a specific receptor in our conjunctiva and cornea. That is the white part of our eye and the clear part where we put contact lenses in. Infection through the eye can manifest in symptoms of pink eye, or what we call conjunctivitis, and several reports, including the one from Nature and other scientific journals, reported that conjunctivitis can be the symptom of COVID-19 patients, and sometimes even be the first symptoms before any respiratory symptoms occur.
So it's the symptoms.
And yes, we need to remember that there is a connection between our eyes to our nose and to our throat through our tear duct, and that's how the virus can transmit from our eyes to our respiratory system.
So what is exactly the process like, doctor? I mean, for example, I'm imagining like how many of the droplets or how much of the droplets that will actually infect, that will be able to make us contract the virus. And how? Is it from the droplets? Is it from, we are
unwashed hands and you rubbing your eyes, because we've seen that a lot, right?
Yes.
Yes, it can be contracted through droplets, but most commonly it can also be contracted when we touch our eyes, when we're not sure that our hands are clean. So because we have the connection between our eyes to our nose and to our throat through our tear duct, that is the process on how the virus can be transmitted through our eyes to the nose and to our respiratory system.
I see. So how can we best protect our eyes from getting exposed to the virus? For example, like the most logical thing that I can think about is to wear glasses, but some of us are not used to wearing glasses. So it's like, how do we best protect our eyes during the pandemic?
Well, first and foremost, in any eye infection, not just for coronavirus, avoid touching your eyes at all costs if it's possible, especially when you're outside your house, and especially if you're not sure that your hands are clean.
Okay.
Right.
But of course, wearing glasses, face shield, or even goggles can help us to prevent us undeliberately touching our eyes.
Right. And doctor, again, with the
Yes.
3 W's, right? Like washing your hands, wear your mask, and watching your distance.
Yes.
Does it really affect also if we're not watching our distance with some other person? Like when they speak and whatnot? Because you were saying that we can get infected because of the droplets that might catch into our eyes, because everyone is wearing our mask now, like almost 24/7.
Yeah.
But does that happen because of the distance-wise?
Distance-wise, yes, it does help, but bear in mind that the virus can stay in some surfaces for quite some time. And yes, so when our hands touch that surface and then we accidentally touch our eyes, then infection can also occur with that process.
So that's
but
why
of course the mask helps.
The mask.
Yes.
The mask really helps. So now, not only that we have to protect our respiratory system by wearing the mask because it covers our nose and also our mouth, but also if you can, you need to protect your eyes, especially if you are going grocery shopping. It's like, because you will be with other people and it would be good for you to wear goggles or a face shield. Now, Dr. Caroline earlier used this thing. It's an eye drop. We're both thinking like, oh, it's probably good to clear the eyes from any dust or debris or maybe viruses. So how effective will eye drops actually in protecting our eyes from all this?
Well, it does help to a certain degree, that it can provide an additional washing effect to our eye surface, in addition to our own tears. It's similar to what an ENT specialist doctor recommend, that we wash our nose with saline solution, and the eye drop works similar to that. But we must also consider that the eye drops that we're using are normal eye drops for washing the eyes, because there are certain eye drops that contain steroids that can have significant side effects, such as glaucoma and cataract. So we need to be careful on which eye drops that we choose to clean our eyes with.
Okay, so this has tetrahydrozoline and benzalkonium chloride. Are they okay to be used frequently?
Well, to a certain degree, yes, but benzalkonium chloride is a type of preservatives of the eye drops itself. So within a normal limit, it can be used as a washing. It's better you use the preservative-free eye drops for regular use.
Okay, and when you say regular, how many times per day are we allowed to use the eye drop?
For the kind of eye drops for artificial tears, that what we call it, you can use it as much as 4 to 6 times a day, especially when you spend a lot of time in front of a computer or a digital screen. Yes, you can use that about 4 to 6 times a day.
All right.
It's quite safe.
Is it safe also for children? Because we know now, especially, the kids are, even though they're staying at home, they're kind of still touching things here and there. Would that be okay also for children to kind of like giving them eye drops? Like you said, 6 times
for
almost.
Artificial,
yeah?
Yes, for those that says artificial tears or saline solutions, yes, it's quite safe even for infants and babies.
Okay, so that's good to hear.
That's good. And speaking of eye health, doctor, I'm thinking as a layman here, if we have a healthy body, it means that we have a higher immune system. It means that we are more prepared in fighting off the virus, right? Now, with this organ, this particular organ, the eyes, there are healthy eyes, but there are also eyes with disorders or diseases. Now, so with these particular eyes with disorders and diseases, will they be more prone to contracting the virus because they're less healthy compared to healthy eyes?
In terms of catching the coronavirus, people with allergies, especially those with itchy eyes that can occur from time to time, will have an increased risk of catching the virus, because when the eyes are itchy, they will be prone to be touching their eyes. So I think
it's just that.
That's yeah, it's just that. But other than that,
like for example, those with glaucoma or those with cataract, will they be more prone to contracting the virus because their eyes are not so good?
No, there hasn't been any reports on people with glaucoma and cataracts in getting coronavirus easier compared to others.
Okay.
All right, doctor. And of course, you know, especially during this pandemic, remember, everyone is staying at home, work from home, school from home, you know, and of course, what we do is basically we're with our gadgets almost 24/7 without, you know, any breaks and whatnot, even children to adults. So how does it make it vulnerable for our eyes, doctor? Because we're constantly in our gadgets.
Yes, it's important that we take breaks between sessions in front of a computer or a digital screen, because when we stare at digital screen without our realizing, our blink reflex decreases and it causes our eyes to be dry, and it can cause numerous symptoms, from foreign body sensation in the eye, redness, tiredness of the eye, and then it can also cause watery and sometimes even a headache.
Right.
Oh yes.
So
absolutely.
It's very important to take frequent breaks between a session of schooling or even meetings and working.
So, doctor, I'm very curious, Dr. Kianti. So, how do you really differentiate your eyes being tired because you're seeing the gadgets, your work from home, school from home, with then contracting the virus itself? So, how can you really differentiate that between like a regular red eye, tired eyes, or you contracted with the COVID-19?
Well, normally, if you're just tired from activities from in front of a computer or digital screen, after you rest, the eye itself will feel refreshed and the symptoms will disappear.
Right.
But when it comes to infection, the redness itself or the feeling of watery and the redness itself will persist. And that's when we need to be worried that we have contracted an infection.
Okay, so your suggestion would be immediately see your eye doctor when that happens, right?
Well, if using an artificial tears eye drops for first help is okay.
Okay, all right. So as a general,
if it doesn't get better, yes. If it doesn't get better in 2 or 3 days, then yes, you should probably be seen by an eye doctor.
Okay, 2 or 3 days is our okay. As a general point, doctor, how do we take care of the health of our eyes in general? What should we do?
Well, in general, we need to wear glasses. If we need to wear glasses, then we need to have the most current prescription that we need. Yes. So we need to have a regular eye check for about 6 months regularly, and also to screen for risk factors for glaucoma and cataract itself.
Okay, is there any food that you would suggest that would actually take care of the eyes? Because when we were children, right?
Right.
Our parents always say, our mom is like,
carrots.
Eat carrots, good for your eyes. Is that true, doctor?
Not entirely true, but similarly, what we can recommend for eye health food is similar to what we would recommend for keeping your heart healthy. So a diet full of leafy green vegetables and grains and low good fat and that contains a good fat. Vitamin C and vitamin E can also make your eyes healthy.
Cool.
So we don't have a specific diet for eyes, but what we eat for our body can also affect the eyes as well.
Yes, that's true. That's
All right,
true. Thank you so
very much, Dr. Kianti.
Thank you.
Thank you.
Thank you so much for
a very
having me.
fruitful discussion.
Okay.
Have a great morning.